bones, low energy, and poor immunity. If you don't get much sun, a supplement may help. Step outside, soak up the sun, and fuel your body with vitamin D.
Radiographer at the radiology departments at the community hospital. We offer high-quality service with state-of-the-art equipment in X-ray, ultrasound, CT, and mammogram. Come, our friendly staff awaits you.
Give us a call at 235-5479.
The Community Hospital of Seventh-day Adventist,
where good private health care is affordable.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson omega-3 is the trusted choice, offering 1800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
So it's well understood that persons with diabetes are at increased risk of developing foot conditions and foot diseases, complications.
Yes.
Before we go into what that looks like, can you explain to the viewers exactly why diabetics are at an increased risk?
Right. So diabetes should be looked at as a systemic condition where every single structure in your body could become affected. Hence the reason you have complications such as retinopathy, neuropathy, vascular injuries, kidney issues, etc. Pretty much wherever there's a blood vessel and a nerve, it could become affected from diabetes. So with the vascular injury, we have peripheral arterial disease where you have poor blood flow, the vessels become calcified, patients could have amputation of limbs, infected limbs, etc., etc. And with nerve damage, you have neuropathy. And neuropathy will affect the joints because the nerves innervate the joints. And then you can have Charcot's arthropathy, and the joints become damaged, infected, etc., etc. So this is the underlying reason why diabetes can affect any part of the body, as a matter of fact.
Right. So, great. So, with diabetics, and those in particular who are not controlling their blood sugar level on a consistent basis, they will be at an increased risk of developing what you say peripheral arterial disease. Their blood vessels are not they're occluded, so you're not getting nice blood supply to your peripheries, your extremities, feet, and you have small nerve endings would be affected, so neuropathy. So understanding that these diabetics, so within the population of persons living with diabetes, are going to be at increased risk for foot disease. What else, or who else in the diabetic population will be at increased risk? People who walk around barefoot?
So you'd be surprised, a lot of the patients who present to us with infection in their feet, the infection would have started several days before. Now, the interesting thing is, neuropathy usually goes hand in hand with peripheral arterial disease. So these patients lose the sensation to feel. Now they may have the ability to have crude touch or general sensation, but that fine sensation, for instance, when a needle sticks them or a thumbtack sticks them, they will lose that sensation. And that is the point in time when they should seek health care. But if they're unaware that they got stuck with something, most times is when their family members a few days after said, hey, your foot is swollen, something is leaking from your foot, you have a discharge, and unfortunately by the time they present to us, the infection would have spread significantly throughout the foot. So yes, it is important to understand that protective footwear is important. You may think that you have the ability to sense or to feel, but because diabetic is such, how should I say it? It's a condition that you should not underestimate. you need to sort the appropriate footwear and wear it at all times, even indoors. Even indoors as well. You know, a lot of patients, they're like, Doc, you know, should we wear the footwear when we indoors? I'm like, well, but
we're accustomed as Caribbean people to be barefoot inside our homes, but you're saying that's really crucial. Wear footwear, proper footwear, nothing tight, even when you're inside. Rubber slippers?
Well, no, the footwear has to enclose the entire foot. So like slip-on footwear.
Good.
Nothing too tight. Preferably prescribed by your orthotics or podiatrist or whichever doctor you're seeing. Make sure that is safe. Right? Sometimes the footwear is a bit too tight, the straps are a bit too tight, and it could cut into your foot and cause small cracks. So it's important. And then you also need footwear that could maintain the arch of your foot. So there are many designs out there that if you do your research, you would be able to wear something that is comfortable, that suits your lifestyle, and something that is cost-effective, especially in your home environment.
So, all right, so we're talking about, we understand now why diabetics are at an increased risk for foot disease. We understand that within the diabetic population, if you're not wearing, if you're barefoot, you're not wearing proper shoes, you're not inspecting your feet on a consistent, regular basis, you're going to be at increased risk for getting foot complications. Can you tell the viewers exactly what should they be looking out for? What should they or the caregivers of diabetics be looking out specifically for the first early telltale signs of foot complications and even long-term?
Right. So in terms of long-term care and the overall preventative measures, I should say, it starts with nightly inspections of the feet. Right? Nightly inspections should be done preferably by your relative. Of course, that is not always the case, and you have to perform the inspections yourself.
Right.
Now, what they're going to look at, they're going to look at between the toes to see if there's any signs of fungal infection. They're going to look under the nails. They're going to look at the sole of the feet to see if there's any cracks, crevices, calluses, because sometimes these are the portals or entry for bacteria to develop infection.
Excellent.
Moisturization is important. You need to moisturize with something that recommended by a doctor. There are many moisturizers out there. And never moisturize between your toes, because toes are areas where moisture becomes trapped and encourage fungal infections. Now, that is how you could prevent. And then you have your serial, whether it's 6-monthly or yearly assessment, where you would see your doctor, where they would do circulation testing, nerve testing, pretty much screening. Same way you would check your sugar every day, is the same way you need to check your feet objectively, an objective measure of your circulation and nerve testing every year. Now, if you already run into a complication, sometimes there are subtle signs that you could look at and pick up before the infection spreads. And this works well, especially if you have a routine every day to check your foot. So for instance, let's say you walk and something's stuck your feet between the toes or under the sole of the foot. Now your relative should be able to pick up that. Because on the night when they decide to inspect your feet, they'll look at it, they alert the healthcare provider, and then we tackle the problem in the early stages rather than late. Now, look for redness. You know, people say look for redness, look for discharge. They may have fever. To me, when that already has manifested, it's a bit
too late.
Too late.
Yes.
Yeah, so there's nothing really such as early signs per se. It all boils back down to preventative measures by daily inspection of the feet.
So you had touched on, and you mentioned it, I should say, a few times, Charcot joint.
Yes, Charcot joint. Yes.
So it's so important, I think. Diabetics, and a lot of people associate diabetic foot disease with infection.
Yes.
But there's more to it than
Much
that.
more, yeah.
So let's just say a patient with a diabetic foot, in terms of they had a cut, it's not healing properly.
Right.
They're not taking care of it, probably didn't attend it or didn't know it was there. And continue using the feet, walking on it, repeated, constant trauma to the foot, and what at the end of, let's say, a couple months, what is the sequelae or the end result of constant repetitive trauma to that foot, that insult?
Right.
What happens?
So I think
in other words, what are the complications? Worst complications you've seen?
The worst complication could be ischemia, and then you have infection. And
Ischemia meaning no blood supply.
No blood flow at all.
Right.
Infection spreads, and then the foot can't be salvaged and you end up, unfortunately, in an amputation. I mean, in our population, the amputation rates, I would say, is about 1 amputation per day, which is quite high in a small population.
Yeah.
Now, that is the worst case scenario. But if you have an ulcer under your foot as a result of an injury that you sustain and you develop a wound, it's important to identify what type of wound it is. We have wounds secondary to nerve damage, what we call neuropathic ulcers. We have wounds secondary to lack of blood flow, that we call ischemic ulcers.
Right.
And then both of them could become infected. So you could have infected ulcers. The location sorts of give away the type of wound. So under the sole of the foot most times is what we call neuropathic ulcers, and you could develop a neuropathic foot, such as a Charcot's foot.
Yes.
Now, with the Charcot's foot, the blood flow is usually okay. It's not the best, but it's usually okay. And the treatment for that ulcer is examining and investigating the depth of the ulcer. Most times patients, unfortunately, just dress the wound, the surface of the wound. So you're dealing with the tip of the iceberg.
Yeah.
And at that point in time is when the bone should be addressed, because there's a condition called osteomyelitis, where the bone is infected. And to treat the infection, you need to treat the bone, which means removing that part of the bone. Now, most patients, when they hear that you need to remove that part of the bone, they run away. And then they keep this infected ulcer for many, many months, I should say, and it spreads to the entire foot, and the foot becomes swollen, and then end up in an amputation. When you have
an amputation of more than just that digit.
Of course.
We're talking about a foot.
Yeah, of course. And this is very, very common. We have patients who would come and see me who have an ulcer under the sole of the foot for 2 years, and they have a very small wound, and they say, "Doc, it looks good, I just want a checkup."
Yep.
And I'm like, okay, let's do some bloods, let's do an x-ray, a simple x-ray. And then we realize the bone is chronically infected.
Yep.
And to treat that, we have to remove that entire bone.
And that's the interesting thing about Charcot joint, is because the patient is unaware of the injury because no pain.
Yes, no pain.
So they're constantly walking, carrying on business as usual. Just a small little, as you say, open entry wound.
Yes.
But when you do the x-ray, what you're seeing is total joint disorganization, dislocation, even dissolving of bones, bone resorption. So loss of bone. Your body is actually losing bone density. And unfortunately, they wait too long. So, sorry.
And you can even develop a Charcot's joint or a neuropathic joint in the absence of a wound. So when a diabetic patient presents to you with swelling in their feet, of course the most common cause of swelling, kidney issues, you also have vein issues, sometimes physiological edema, overweight, standing for long periods of time, cardiac issues, especially in diabetic patients. But if all the investigations are done and ruled out and the patient is normal, you ought to investigate the foot. And simple x-ray is what gives it away. And the x-ray will show what we described before as joint disruption. So I have many patients present to me, and this is a classic presentation. "Doc, this happened, this is the 5th time in 2 years, my foot's swollen, but don't worry. I go by the doctor, he prescribes some antibiotics, he tells me elevate the feet, and it goes down." And with Charcot's disease, it does go down, but that is where you missed the boat 2 years ago. And because you don't have feeling, you keep walking on it, the joints become destroyed.
Exactly.
You walk on it more, becomes more destroyed, it heals, destroyed, heals, and it's a vicious, vicious cycle. And then the foot is significantly deformed, and they're walking on areas of the foot that are not designed to tolerate pressure. And then they develop neuropathic ulcers as well, they develop deformities. So it's quite important to have a holistic approach when the patients present, because Charcot's disease to me is not well known in our population and often missed sometimes. But if we were to educate even the healthcare providers and the patients, this
I agree with you. So walk us through. Mr. Smith is diabetic. He notices he has a cut that's not healing. Goes to the doctor. Walk us through, what should Mr. Smith expect from the doctor? Proper care. What does that look like?
Basic med school days.
Right.
Many years ago. history, examination, investigations. And from those, then you formulate a management.
Good.
Right? The chronicity of the wound. How long has the wound been there? How did he get it in the first place? Was he aware? What treatment did he had so far? How well his sugar is controlled? Does he have other comorbidities? Does he have kidney impairment, cardiac issues? How well is his nutrition? These are the simple things that are often missed, right? That could lead to this wound taking so long to heal. Once I do a proper history, then my examination, of course, you examine your pulses, right? You examine his nerves, you examine where the wound is, and there's something called a probe to bone test, right? Probe to bone test means you take a simple metal device like a forceps, you look at the wound, you clean the wound, of course, and you probe. And if you touch the bone, more than likely, the bone is infected.
Right.
And this is where you have to do your investigations after. Your normal blood investigations, your blood count, see how well the sugar has been controlled, something called a HbA1c, a kidney function test, of course, and an X-ray. And once you have access to all these, then you'll be able to give the patient a reasonable diagnosis and explain and justify what you need to do and why you need to do it. Most times I also take biopsies of the bone, you know. Many times the patient have a superficial swab. Think about the infection as the initial bacteria that caused the infection deep in the bone, and the bacteria that join the party afterwards, or the secondary bacteria not invited to the party, so they're just liming around the club. So when you swab, you get the bacteria that did not initially cause the infection, and you get a culture and you give them antibiotics directed towards the bacteria that did not cause the infection. So you need to really do deep tissue biopsies.
And get the root cause.
Yeah, and get the root cause. So this is my approach for when...
So my question to you is, should a patient, as we described, go to their GP, health center, or an orthopedic specialist?
No, diabetes is a multifactorial disease. And when it comes to a wound, with regards to the foot, the management is a multidisciplinary team approach. The wound itself, I think, should be done by a vascular surgeon or orthopedic surgeon, depending on the type of wound. So if it's an ischemic ulcer, due to lack of blood flow, of course, the vascular surgeon. If it's a neuropathic ulcer based on nerve damage and the bones become destroyed, of course, the orthopedic surgeon. Now, the role of the GPs there must not be, it's very important, right? The GPs or the diabetologists or the endocrinologists, their role is extremely big. I mean,
they're like the project manager.
Of course, they have to control the sugar, assess other risk factors. So I don't think there's any one-man management strategy for these patients.
Okay. So we've explained and underscored, and I really hope that we drive home that message that diabetics, first off, are at increased risk. We know why, because they have poor blood supply to their extremities. They have neuropathy or nerve damage. So they need to do certain things to make sure that this doesn't happen, this end result of losing limbs, losing joints. Because if you lose your foot, you can't ambulate. You can't ambulate, you have no freedom, you have no autonomy of yourself.
Not just that, if you can't ambulate, the studies have shown the mortality rate is significantly increased. Worldwide mortality rates, 50% of patients who had an amputation actually die within 5 years.
Correct.
Which means if you do 100 amputations, in 5 years' time, 50 of those patients not going to be around. Now, the reason why depression
has now gone up. Thank you for saying that. Most of these patients
are the breadwinners, are the home men in their mid-50s, you know, working hard, don't have access to proper food, get an amputation, and their whole lifestyle have changed. From a guy who's a go-getter, you have a guy now confined to a wheelchair, he's depressed, his wife's seen him with one limb. And when you become depressed, you're non-compliant, you don't want to hear about medication, you might start drinking. You know, you don't eat properly, and then your entire physiological status just goes haywire. The sugar levels go higher, you develop secondary complications, kidney impairment, and you literally you die from depression. It's very high. And in Trinidad, that percentage is actually 70%.
70%.
70 within 5 years. 70%
so
of patients
again,
die.
we're underscoring the need for patients with diabetes, caregivers of diabetic patients, to do the basics. And the basics, we're talking about prevention.
Yes.
Prevention, of course, always better than cure. We want to nip and pick up these little cuts, bruises, blisters, corns, calluses early.
Yeah.
So tell us little tips and tricks for the diabetics, practical tips and tricks for the diabetics out there about foot care.
Right. So foot care for me is inspection
Right.
and addressing minor issues. Inspection, there are many forms online that you could see or even get from your GP how to inspect the feet, what to look for, and if you pick up these issues, how do you manage it? What types of moisturizers to use? Should there be water-based? Should there be oil-based? How to cut your toenails, so for instance. You know, when we cut our toenails, we tend to curve into the corners.
Which is wrong.
That is wrong for diabetic patients because sometimes you could nick the skin and that's a portal entry. So who should you see? A podiatrist, right? And let the podiatrist show you. If you have corns and calluses, the podiatrist, they can actually
put a pin in that to tell them exactly how they should be cutting their nails straight across, right?
Straight across,
and
cut your nails.
level with the skin, not deeper.
Not deeper than the skin. In terms, some of them do these foot soaks.
Yes.
You know, that's a bit dangerous for me because they would go by whoever they go by the spas and they have foot soaks and they might have small scratches, cuts, calluses in their foot that they're unaware of, and that water in there goes in there and they become infected. So if you have to do what we refer to as a foot spa, preferably do it with a podiatrist, right? Because they would have the resources there at their facility where they would maintain a sterile environment. And I think foot spas are important, but we have to redefine a foot spa for a diabetic patient versus a foot spa for a non-diabetic. So for instance, if you have a callus as a diabetic, you can't ignore it.
Yes.
You have to remove it. Who removes it? Not you, not your family member, a professional. And the problem is most of these corns and calluses come back, right? So when you remove it, you have to bear in mind that in the next few months or so, it might come back and you have to go back to the podiatrist. So there's very little that you could do at home as a diabetic patient other than inspect your foot daily and nightly, other than cut your nails. But once you identify issues like cracks and calluses and corns, or even fungal infections, unfortunately, you need to seek a healthcare professional advice. I need to be monitored in order to prevent the complications.
Great. So before we leave, is there, I would like to know if you want to leave the audience with one piece of information, one golden nugget of advice on diabetic foot, on persons living with conditions related to diabetes with their feet. Where's that concerned? What would that be?
I mean, to me, managing your feet is like managing your diabetes overall. You can't myopically focus on your feet and your sugar control is high. So it all boils back down to diet, exercise, and proper footwear, basic stuff, right? You maintain a healthy diet, you eat appropriately, you take your medication if you need to. Quite often we try to explore alternative routes in terms of controlling our sugar, and we have these herbs and so forth, right? So I mean, yes, we can't stop them from doing what they need to, but it must have some evidence-based approach. So proper diet, proper exercise, take your medication, and a routine that is in keeping with international guidelines to inspect your feet. That is my take-home message. Because once you have a complication, you're already a bit far gone, and unfortunately, we can't make your foot better. We just have to manage it where it is at that point in time.
Thank you very much.
No problem.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson Omega-3 is the trusted choice, offering 1800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
Do you need treatment for obesity or any related abdominal procedures? The community hospital now offers minimally invasive laparoscopic surgery done by an American-trained, board-certified surgeon with over 20 years' experience. Give us a call at 235-5479 for more information.
The Community Hospital of Seventh-day Adventist,
where good private health care is affordable.
If you love tofu as much as I do, you are going to absolutely love this next recipe that Chef Emmanuel has concocted for us. It's called stir-fry cabbage with tofu. It's absolutely delicious and easy to prepare. Chef? So this is a general rule that if your pot has flames like that, this is going to taste really good.
Yeah, so you get that Chinese umami flavor.
Common presentation are menstrual disturbances, so prolonged and heavy and often very painful periods. So rather than a fairly normal 5-6 day menstrual cycle period, they might get incredibly heavy bleeding for 2, 3, 4, 5 days, and it might be prolonged to 7. This bleeding month on month on month can then lead to a drop in the hemoglobin levels and anemia, which can be very tiring. They can also be very painful. Some women will bleed constantly and not have a cycle at all. They'll bleed for 30 days, 40, 50, 60 days.
WESN. is your WESN News on the Hour. I'm Naomi Macnish. Thanks for joining us. Here are the headlines. Motorcyclist dies in crash on Archibald de Leon Highway. Young defense handling of Nikon explosion report. Scoreboard glitch. Poor seating mar World Cup qualifier. Angostura scaled back support for a concert headlined by Vibes Cartel. And internationally, curfew and internet blackouts in Manipur after protests erupt. Now for the details. A 34-year-old mechanic from La Romaine is dead following a motorcycle crash in Point Fortin on Saturday night. Kenzie Blondell was riding along the Archibald de Leon Highway around 7:30 p.m. when he lost control of his blue Suzuki 600 near the Vance River overpass and slammed into concrete barriers. A fellow rider told police Blondell had attempted to merge in front of a silver Honda Civic. He was taken to the Point Fortin hospital but died about an hour later. Investigations are ongoing. Former Energy Minister Stuart Young is standing by the ministry's decision not to release a report into a deadly explosion at the Nikon energy plant last year. In a social media statement, Young said the ministry acted on legal advice and could not release the report without consent from Nikon, which had not agreed. However, the High Court ruled last week that the ministry's refusal to share the report with the victim's widow was unlawful. Alan Lane Ramkasoon, a pipe fitter with Massey Energy, died days after sustaining severe burns in the June 2023 blast. Young said current Minister Dr. Rudal Monilal's criticism were unfair. A malfunctioning scoreboard and chaotic seating arrangements frustrated fans at Thursday's World Cup qualifier between Trinidad and Tobago and St. Kitts and Nevis. The sport company of Trinidad and Tobago said the scoreboard was functioning during testing but failed shortly before the match began. Meanwhile, spectators complained about disorganized seating in the covered section of the Hazley Crawford Stadium, with many forced to stand or sit in aisles despite having valid tickets. No timeline has been given to fix the scoreboard issue. Angostura Holdings initially approved a TT $6 million sponsorship for the now controversial One Caribbean Music Festival, but later scaled it down to $400,000 TT. Internal documents show the company had concerns over visibility as a title sponsor and potential risks, including immigration issues with Cartel, financial losses, and venue availability. Cartel did not perform at the May 31st event due to a payment dispute. Angostura later distanced itself from the concert, saying it was only a brand sponsor, not involved in its management. Internationally, tensions are rising again in India's northeastern state of Manipur following the arrest of 5 leaders from the mighty group Arambai Tengol. Violent protests erupted in Imphal after their detention, prompting authorities to impose an indefinite curfew and suspend internet services in 5 districts. A 13-year-old boy was injured during clashes with police. The group's leader was arrested for alleged involvement in 2023 ethnic violence. The Congress Party has slammed Prime Minister Narendra Modi for failing to restore peace, accusing him of neglecting the region. Well, that's news to the hour on WESN. I'm Naomi Macnish. Thanks for watching.
WESN.
We're diving into a topic that affects about 422 million people around the world.
It's more commonly referred to, as you said, as diabetes or sugar.
Just making sure we break it down and we understand.
Yes. Vitamin D is a bit more tricky.
So somebody like me, when I hear vitamin D, I think go out in the sun, like I go on and lie down and just take vitamin D.
Exactly what is a good diet? How many of the diabetics know what is a good diet?
Me, I can't get me to eat thoroughly, no liver, and I ain't drinking no more beer.
And you have high blood sugar because your insulin, which is a hormone that your own body produces, is not enough.
You must be mad. Welcome to Wellness Unlocked with Jameson. It's Rome, and today we're diving into a topic that affects about 422 million people around the world. Diabetes, or as some of the old people might say, sugar. So to guide us through this journey, we are joined by a few professionals. First off, we have sports and exercise medicine health coach and radiologist Dr. Tonya Welch, registered dietitian Ms. Onella Selena, and pharmacist Mrs. Nanan Ramprasad. With years of experience under their belt, these professionals are here to give us some important insights, so it is my privilege to welcome these ladies on set. Welcome.
Thank you so much.
All right, so jumping in one time, what is diabetes? Dr. Welch.
So diabetes mellitus is a medical term, right? And it's more commonly referred to, as you said, as diabetes or sugar, right? Diabetes mellitus has many, many different subtypes. And we talk about type 1, we talk about type 2. Today we're talking about type 2 diabetes mellitus. And what that is when you essentially have high blood sugar. And you have high blood sugar because your insulin, which is a hormone that your own body produces, is not enough. So insulin is this hormone that is produced by your body, as I said, and it actually needs micronutrients and trace minerals in order to help it function well. So things like magnesium, chromium, zinc, all these things help insulin to function well.
Okay, so the insulin is controlling the blood sugar levels.
Correct.
Anybody?
Correct.
All right.
Power your day and manage your diabetes with one multivitamin. A review published in the American Diabetes Association Journal highlights the positive effects of B vitamins in managing nerve damage caused by diabetes. That's why Jamieson's multivitamin with 400 micrograms of added chromium is formulated with essential B vitamins to support energy metabolism and help maintain nerve health. Manage your diabetes with Jamieson multivitamin today. Look for Jamieson at your nearest pharmacy.
Are you living with pre-diabetes or type 2 diabetes? Manage it with the unique Jamieson 100% complete multivitamin with 400 micrograms of chromium to lower blood glucose, lutein for your eyes, B vitamins for energy, vitamin C and lycopene for antioxidant support. Take a step towards a healthier tomorrow and make the proactive switch to Jamieson today.
What if the missing piece to feeling great is already within reach?
My mom suggested Jamieson's multi for diabetic support. I'm glad I listened.
Adding Jamieson multivitamin to your daily routine makes a big difference.
I finally have time to really focus on my health more than ever before.
Jamieson multi with chromium has been a great addition to my routine. So if you're looking for that added support for managing your diabetes sugar levels, Jamieson multi with chromium is the product to trust.
I've been using Jamieson products for years because I trust their quality. If you're looking for a brand you can rely on, choose Jamieson.
I choose Jamieson and it have my back, and trust me, Jamieson have all their back too.
Let me get Onella in this. So Onella, what is the importance of chromium?
All right, so as she mentioned, chromium is a trace element, so it's needed in small amounts, but it has a big impact. It's very crucial in managing the insulin action. As we know, the insulin acts as the key to open our cells for it to utilize that sugar in the blood. So that's where we see the importance of chromium to help manage our blood glucose levels, especially for persons with type 2 diabetes.
So the insulin opening the cells to allow the sugar to get in.
Yes.
And the chromium helping the key to open better?
Correct.
All right, I'm just making sure we break it down and we understand.
Yes.
All right, so let me ask, are there any other vitamins or minerals or nutrients that operate in the same way as this chromium would?
Absolutely. So there are a range of vitamins, minerals that we need in order for insulin to function, right?
Restricted diets don't have to mean restricted nutrition. Jamieson's multivitamin is thoughtfully designed to provide the vitamins and minerals you may be missing, all in one convenient supplement. The Office of Dietary Supplements found that multivitamin and mineral supplements can help fill gaps in essential nutrients, especially for those with restricted diets. Simplify your routine with Jamieson today.
My job is physically demanding, and managing my diabetes makes it even more difficult at times. Jamieson's multi 100% complete vitamin with chromium provides me with the vitamins and minerals I need to keep going strong, healthy, and keep my blood sugar levels in check.
Being on my feet all day can be tough, even working long hours. When I found out my sugar was high, I knew I had to take better care of myself. So my mom suggested Jameson's Multi for diabetic support. I'm glad I listened. It is designed to give me the vitamins I need while helping me manage my blood sugar levels. I feel stronger, more focused, and ready to take on each day. Thanks to Jameson, I'm staying ahead of my health and my work.
So, outside of the magnesium and the chromium, are there any other vitamins or minerals that you all would suggest in terms of managing your diabetes, or suggest for someone with diabetes?
Certainly. So when we're talking about diabetes, we have to have the conversation about B vitamins, specifically B12. So persons who are diagnosed with diabetes are oftentimes on metformin, and persons who are on metformin over time tend to be deficient in vitamin B12. So we need to ensure that we get adequate amounts, firstly through our diet, and then we can introduce supplementation to help us meet our daily intake.
Now you mentioned diet. So in the things that we eat daily, are some of these vitamins and nutrients present in our foods that we would eat?
Yes, definitely. So as I mentioned, the B12, we can get that from foods such as chicken, we can get that from eggs, we can get that from fortified options. Other nutrients that would also be of benefit would be vitamin C, vitamin D, as well as zinc. So for vitamin C, we know we can get that from our oranges. We'll say, I'll suck to orange and get it. That can also be an option. Vitamin D is a bit more tricky because, for example, if I take mushrooms, do you have that every day?
I wish I was that fancy,
right.
But no.
So mushrooms can be an option, but it also depends on the time frame from farm to table. It also depends on the exposure to sunlight. So we sometimes need that added support. And with zinc as well, I must make mention, it also helps in managing your blood glucose level. We may know it as our immune support nutrient, but it also plays a role in managing your blood glucose levels.
Okay, so somebody like me, when I hear vitamin D, I think go out in the sun, like I go on and lie down and just take vitamin D. So that can work?
That's the natural thinking, but right now we're indoors as well. So oftentimes you don't get sufficient exposure, so supplementation becomes a priority.
Okay.
When it comes to your health and wellness, trust matters. That's why Jameson is proudly Health Canada approved. With over 100 years of expertise, Jameson vitamins and supplements meet the highest quality and safety standards, giving you confidence in every tablet, every time. From immune support to daily wellness, Jameson is your trusted partner for a healthier, happier you.
Jameson supplements are made through a 360-degree quality process that removes any impurities and ensures high quality, including vitamins and supplements.
What if the missing piece to feeling great is already within reach? Being a classical dancer, a massage therapist, and a vegetarian chef, my friend introduced me to Jameson 100% multivitamins with chromium, and it's been a game changer ever since. Diabetes running in my family, I am always worried about my sugar levels. With the added chromium, I choose Jameson to control my sugar levels, my late night cravings, and also increase my metabolic rate and energy throughout the day. I choose Jameson and it have my back, and trust me, Jameson have all your back too.
In retirement, I finally have time to really focus on my health more than ever before, especially my type 2 diabetes. Sometimes I used to get very dizzy and lightheaded, so I needed a little extra support. Jameson Multi 100% complete vitamin with chromium has been fantastic. It helps me feel energized and balanced. And the chromium has really supported my metabolism. Even as the activity levels change, I really notice I don't feel as sluggish in the afternoon. I feel more balanced and in control. This multivitamin has given me the confidence to enjoy my retirement to the fullest.
Okay. So, Natasha, I want to bring you in here as our pharmacist on set.
Sure.
We're hearing from Onella that a lot of these vitamins and nutrients are present in the foods that we would eat and are accessible to us. So someone who has diabetes and they're saying, well, I have a good diet, I'm exercising, and I'm on medication, is supplementation really necessary?
Now, Rome, exactly what is a good diet? How many of the diabetics know what is a good diet? So supplementation can actually assist in filling the gaps that might occur in your diet. So we have the chromium, as we've been speaking about, the vitamin D, the magnesium, the zinc, the Bs, which your body may be depleted of based on the medication that you are taking. And all of those can be found in vitamins, over-the-counter vitamins, that can help overall health and well-being.
In analyzing a client's diet, you may realize that they are deficient in key nutrients, and the first thing would be to tweak that, to change it up to meet that goal. But based on their medication and other factors, supplementation may now become a priority. As
and
I
things
mentioned,
that they like to eat too, because
yes,
some people do like to eat. Me, I can't get me to eat correctly, no liver, and I ain't drinking no Moby. Your Moby mad.
And just to bring it back, I mentioned B12. So if you're on metformin, we may need supplementation to help you get sufficient amount of B12 on a daily basis.
All right, so we're realizing that diet, exercise, supplementation, and your medication is important. So when someone has diabetes and they heard this from you guys here, and they're like, okay, I need a supplement. They come to Natasha at the pharmacy and they say, recommend a supplement for me. What would you guide them on?
Right, now especially for diabetes, diabetics, their eye health is very important. So I'm also going to look at something with vitamin A and lutein, which is an antioxidant, while choosing the product. I am also going to keep in mind, we need to get a product that's specially designed with safety and effectiveness, which will generally give us well-being and health wellness.
So thank you very much for joining us today and giving us all of this information, because I definitely learned a lot about diabetes, about my diet, about supplementation, about exercise and medication. So we put in all of this together for you at home. If you suffer with diabetes, you may have a friend or a family member who suffers from diabetes as well. We hope that you learned a lot and that you apply it to your lifestyle. Ladies and gentlemen, I want to thank you very much for joining us. This has been Wellness Unlocked, all courtesy Jameson.
At 50, managing my diabetes means watching what I eat all the time. It's not always easy to get the nutrients my body needs, which is why Jameson Multi with Chromium has been a great addition to my routine. The Chromium helps balance my sugar. Vitamin B gives me the energy I need to keep focused. I've been using Jameson products for years because I trust their quality, and this multivitamin is no different. If you're looking for a brand that you can rely on, choose Jameson.
Your blood sugar breakthrough starts with Chromium. The Journal of Molecular Nutrition and Food Research 2018 study found that chromium supplements can help the body manage blood sugar levels in persons with type 2 diabetes. Jameson multivitamin with 400 micrograms of added chromium supplement is specially formulated to provide the right balance. Chromium helps your body use insulin more effectively, supporting healthy blood sugar levels and helping you take control of your health. Take control of your blood sugar. Choose Jameson's multivitamin today.
Hi, I'm Melissa, diabetes educator. Managing diabetes can be a bit challenging, especially for those on the go. That's why I recommend the Jameson multivitamin with chromium for diabetic support. Adding Jameson multivitamin to your daily routine makes a big difference in your blood sugar levels and your energy, especially on busy days. So if you're looking for that added support for managing your diabetes sugar levels, Jameson Multi with Chromium is the product to trust.
Are you living with pre-diabetes or type 2 diabetes? Manage it with the unique Jameson 100% complete multivitamin with 400 micrograms of chromium to lower blood glucose, lutein for your eyes, B vitamins for energy, vitamin C and lycopene for antioxidant support. Take a step towards a healthier tomorrow and make the proactive switch to Jameson today.
Take charge of your health with Jameson Multi 100% Complete Vitamin, your all-in-one solution for daily wellness. Packed with vital nutrients and fortified with 400 micrograms of chromium, it's specially designed to support blood sugar management, making it ideal for those at risk or living with diabetes. Feel confident knowing you're getting 100% of your daily vitamin needs in a trusted formula that's Health Canada approved. Find it at your nearest pharmacy nationwide.
As always, we appreciate you starting your day with us. Let's get into this morning's first conversation.
Is the country's healthcare system more at risk more than ever?
Why it has remained unaddressed for so long?
Political parties get lots of cash, big cash from financiers, and then when they get that now, you can't account for it.
But it's really the specialist nurses who we are in a greater shortfall for.
We can tap into the resources and have them, at least form some mentorship programs.
Highlight our food systems, and which will attract persons from all over the world to come and experience something that actually supports the local economy.
We're lucky that we have a vibrant legal system that allows change to take place, and it's not that matters are just swept under the carpet and discrimination is allowed to be perpetrated.
A lot of people don't know that there were attempts to ban the carnival.